Hi, this is the Friends with Medical Benefits podcast. This is a podcast dedicated to two friends who got back together after 20 years to discuss their journey, one having had colon cancer and the other with early onset Alzheimer's. If you want to check out our backstory, you can visit us on YouTube.
Hi, I'm Bill. I'm 60 years old, and I recently retired from teaching high school English after 30 plus years, mostly brought on by complications from having had colon cancer. I had colon cancer 5 years ago, and then it metastasized to my liver, and I had to have a partially removing of my liver 3 years ago. And although I'm currently cancer-free, there have been many complications and health-related issues that I believe are worth discussing. There are people out there who have been touched by this disease, either personally or through family members and friends. And I believe there's a lot that we could talk about that can make people's lives easier.
Hello, I'm John, and I'm a 34-year retired family physician who has Alzheimer's. I'm here to share the highs, the lows, and the in-betweens of my life and treatment of Alzheimer's.
Although we're partners here, and we're certainly not large enough to have guests yet, today's episode is going to seem kind of like I'm the host and John is my guest, because we really want to jump right into this whole issue of the early onset Alzheimer's and what John is experiencing and how he could share that experience to hopefully make people's lives better. So let's kick this off with the first question. All right, so you remember how when we were kids and we were going to play a game, I was always that guy who had to go over the rules before we started. What if this happens? What if that happens? Mainly because I thought it would save a lot of arguing down the road. That's kind of how I want to kick off this podcast. But rather than the rules, I want to discuss a little terminology, because if we're going to be using words, I don't want to fall in the trap of using them interchangeably or using them incorrectly or confusing our audience.
Okay.
And maybe this first question can only be asked by a retired English teacher, but this matters to me.
Okay, let's do it.
I know you say Alzheimer's.
Yes.
But some people say Alzheimer's. Potato. Is there a correct pronunciation or a preferred pronunciation?
Generally,
what is it?
Generally, it's Alzheimer's, but some people do pronounce it differently. But yeah, there's a little potato in there, but the general pronunciation
I always used to say
Alzheimer's.
And I actually started saying Alzheimer's because that's how you were pronouncing it, and I figured that would be the correct way. So we're going to say Alzheimer's, but we welcome Alzheimer's people here.
Absolutely.
Correct? Okay. Now, a big mistake, though, that I do see in the general public whenever I see any stories or articles about Alzheimer's/dementia. Those terms seem to get used interchangeably. I know there's a distinct difference between the two, but they come up in conversation, and sometimes I hear them really used synonymously. So could you break us down the actual meanings of Alzheimer's and dementia and how they relate and how they're not the exact same thing?
Okay. Well, that's a really good question, because you're right. That is a confusion that a lot of people have. Dementia is a general term for cognitive decline. It's aging. It's all different types of declines in cognition. Alzheimer is one particular type of dementia. So look at dementia as the big umbrella, and Alzheimer's falls under that umbrella. You have other types of cognitive decline that fall under the term dementia. For example, you'll hear of Lewy body dementia. You'll hear of vascular dementia. One of the ones that is now out in the public is frontal temporal dementia, which is the one that the actor has. So, Bruce Willis, he has the frontal temporal dementia. Those are all different subsets of dementia. So dementia is just a term for the medical decline of cognition, and the different types are the specific names, like Alzheimer's being one type.
Now, another term that I've heard used with multiple meanings, or at least two different meanings, is the term early onset Alzheimer's. Now, before I explain the two ways I've heard them used, you qualify for both. Because I believe technically the term refers to anyone who is young when they are diagnosed, with, I believe, 65 being considered around the age where it would not be early onset.
Yes.
But early onset could also refer to the fact that it was found early, that you're in the very early stages. So you're actually both at the age 60 you would fall under that definition. And the fact that you're very early in the diagnosis would put you there too. So how do you define early onset as it relates to you, or how is it used medically?
Medically, early onset would be, as you said, diagnosed before the age of 65. But you're right. People will interchangeably say, oh, I'm early onset, and they may be in their 70s or 80s. But really, that would be more early diagnosis, early in the
Okay.
diagnosis. Early onset, by definition, would be before the age of 65.
Okay. So you're early onset with early diagnosis, but if people misuse early onset, they're going to actually be accurate in
Yeah,
their situation anyway.
right. People understand, and it's conceptually, it really doesn't matter.
So here's where we get to the part that's unique, interesting, and I want to say interesting carefully because this is a whole issue that we want to do with all the sensitivity in the world.
Absolutely.
At no point are we going to be taking this lightly, the situation. Uh, I think what we need to do here is for you to talk through how you came to this realization as a physician, as somebody who was still in their 50s only at the time. What were the early signs, or how did you come to this conclusion? First, on your own, before we get to the medical parts of it, but how you realized something just wasn't right.
That's a really good question. Fortunately, being a highly functioning physician, one of the things I started to notice was problems, particularly at the office. This started about 18 months ago, and I first started noticing little things going on at the office, like when I'd send people out front for a referral, the secretary would come back and say, you told this patient you were going to refer them to orthopedics or a specialist, and I don't see the referral in the chart, which wasn't common for me. Procedurally, I'm pretty on the spot with getting my stuff done. When I send someone to the front, I've already got the referral in, I've got the follow-up appointment in, and some of that stuff was starting to kind of come back to me, and the secretaries were walking back saying, hey, did you mean to see this person back in a week or 2 weeks? And it just wasn't getting there. I started to know some of that. And then about 6 months before I really started to know problems, I had a nurse for 17 years who was like family to me. And she was my right-hand man, so to speak.
I think we kind of made the reference when we were talking about this before that she was kind of like your radar in the MASH reference. Like when you turned around, she was there with everything you needed.
Yeah. She knew what I was going to do before I knew what I was going to do. Yeah, I was definitely dependent on her. We were a great team. So when she left and I got a new nurse, the new nurse was fantastic, but I didn't have that real backup of someone who really knew me and was able to kind of assist me along the way. And I started having more problems. Like my nurse before my current nurse would have said, hey, look, Mrs. Jones has a right elbow pain, and she was in for a regular appointment. And I'd go in and I'd see Mrs. Jones, and 90% of the time I'd ask her, hey, Joanne said you have right elbow pain, and we'd talk about it and we'd make sure that was taken care of. Well, sometimes my new nurse wouldn't say that, or sometimes when I'd come out, I'd just go to the front and I might get my secretary coming back and say, hey, Mrs. Jones mentioned something about her right elbow pain, and I'd realize I forgot that my new nurse was telling me about the right elbow pain before I went into the exam room. Usually when I'd come out before that with my old nurse, she'd say, hey, what was the elbow pain with Mrs. Jones? And if I had forgotten to do it, it'd click in my mind, oh, I got to go back in there. And that was happening for about 6 months. But it became very obvious when I didn't have Joanne backing me up. And I started to find that I was forgetting who I saw during the day. I mean, I'd see 18 people, and I was lucky if I could remember the names of 2 of them. Just subtle things. I could remember exactly what I was seeing people for. I was getting labs back at night and handling them fine. But sometimes I get a lab back and I'd say, oh, when did I see this person? And I wouldn't realize that I'd seen them in the morning and they went to get their labs that afternoon. Now that's the short part of it. The little bit longer part of it is I then had a couple of procedures done. I had to have a couple of surgeries. They were minor things. I had some screws in my ankle. One of them was starting to come out and ortho took it out. I then had a couple little masses on my abdomen that had to come out. Nothing major, but I was out for a little bit of time. Then I went back to work for a week. And when I was out, that was maybe for about 3 weeks. I was kind of wondering what was going on with me. I went back for a week and then I had to go have cardiac ablation. And that's a procedure where they go in and they basically find a circuit in my heart that was almost like a little short circuit that caused my heart to beat really fast. And I had a few episodes of that I had to go into the ER and be treated. So I was going in for that. I had been back to the office for a week and I had struggled getting back into the flow of things. And once again, I had just kind of felt like something just wasn't right. Have the ablation. One of the things you have to do after the ablation is you got to take it easy for a couple days. And particularly the day after, I had to lay in bed. You know, you have to lay down and not do anything to protect the site from where everything happened. And I was laying there and I just started really thinking to myself, and I hate to say introspection, but that's what it was. I came to the conclusion that something was wrong and I couldn't quite put my hand on it. And I started to get very anxious about going back to work the following week. And that afternoon, it really dawned on me in my head, I don't know as though I belong seeing patients. And that was a tough realization at that moment. You know, I've been doing this for 30 odd years, and now all of a sudden, I don't know if this is really the right thing to be doing. And the more I thought about it, the more I thought, I don't know as though I'd want myself or my family to have me as a doctor right now until I know exactly what's going on. So that, it was a Thursday morning. I text my partner, a good friend of mine, and I said, hey, you know, I've got to come in and see you today, and we got to talk. He called me. He's a morning guy, which I'm not, as you well know. He called me right back and he's like, John, what's going on? And I said, I really need to come in and see you. I got a problem. And he's actually my doctor. And he said, sure. Come on in. What time? You know, I think I went in there about 10 o'clock. And I had kind of decided that I was not going to go back to medicine until I figured out what was going on. And to be honest, I had a mini mental breakdown. I was really anxious. I was stressed. I told him, I don't think I can do this anymore. There's something wrong. I don't know what it is. I was emotional. I was crying. I said, there's just something not right. And he was great. We have a friend who's a psychiatrist. He said, hey, look, I don't know either, but let's get you some help. Let's see what we can figure out. So he referred me to one of our local psychiatrists who got me in within a couple days, and great guy. You know, he said, look, first thing, let's kind of get you relaxed. Let's get you calmed down, which he, you know, started me on some medications, which helped. And he saw me weekly for a few weeks, and we started talking about things that were going on. And I didn't have any mental health history. I've never really had significant depression or anxiety. I mean, we all have ups and downs, but nothing really this significant. And about the third visit with him, he said, you know, you're young, but I suspect there might be something going on with your memory, which was insightful because I hadn't really thought of that. And we talked a little bit more, and I said, you know, that is something that could be going on. And he knew I had a neurologist for my neuropathy. He said, I'd like to have you see your neurologist and talk a little bit about memory, maybe get some memory testing. In the meantime, he said, let me start you on some some medications for memory, and come on back and see me in a week or two. So in that week, what I did was I knew there was a family history on my mother's side. My grandmother at an older age had developed dementia, whether it be Alzheimer's or vascular dementia, it didn't matter, but she was in her late 70s, early 80s. But her sister had Alzheimer's when she got it in her late 50s, early 60s. So there was a little bit of history on my mother's side, but nothing direct for me. But I really didn't know much about my father's history. So I was able to, through a family member, get some information and find out that he was diagnosed with early onset Alzheimer's. So he started having problems in his early 60s. So that kind of threw the alarm bells off in my head. At that point, I go back and I followed up with my psychiatrist, and emotionally, I was much more stable. The medications were kind of easing a lot of my anxiety and keeping me more in touch with what was going on. We talked a little bit more about the memory, and then I told him the family history, and he said, yeah, that's worrisome. He has as many psychiatrists, he had a good background in dementia and Alzheimer's. And he said, I'm a little concerned for you. He said, when's your appointment with neurology? I said, next week. So at that point, I went and I saw the neurologist. And a week later, I basically told him the story I had told you, having problems at work, these things. I was also noticing some stuff at home during the last month. I had an episode where my daughter was working at night, and she called me up one night for work and said that one of her friends was going to come over and drop something off. Well, about 2 hours later, our doorbell rings and no one comes to our house at 10 o'clock at night. And I opened the door and it was one of her friends, and she said, oh, I'm here to drop something off for Sophie. And I didn't put two and two together, and my response was, oh, you're going to need to go to the bar. She's bartending tonight. You're going to need to take it to her there. And she's like, no, she wanted me to drop it off here. And then it just kind of dawned on me, yeah, Sophie called me 2 hours ago. So I was sharing that, a couple other things that had happened to me. A lot of times in that last few months, I'd be driving with my wife, Portia, and if we were talking about something or having a conversation, I'd miss a turn. And I wouldn't get lost in the sense that I didn't know how to get to where I was going. I just wasn't multitasking well, which I think kind of fits into what was going on at the office. I couldn't hold the conversation, focus on what we were talking about, and focus on the directions of the driving. I wasn't missing stop signs or anything like that, but the subtleties of, hey, I got to make a right at this street to go to the bank. I'd go right by that and she'd say, oh, you missed the turn. So when I told my neurologist that and I told him my history, he said, yeah, that's concerning. He did some memory testing and I scored a little low on it, lower than I should have for my age. And he said, some of that still could be the anxiety, but I'd like to do some further testing. And that's really where the whole process of trying to get a diagnosis started. It started with the psychiatrist who was in tune with, just not assuming I was having anxiety and a mental breakdown, to a neurologist who was willing to listen to me and realize that as a physician, I probably wasn't functioning at a level I should be functioning at. And the psychiatrist had already put me out on short-term disability, and the neurologist completely agreed that until we had a better idea what was going on, it was not in my best interest or in my patients to do it. So that's how we got to working on a diagnosis.
Is that how you ended up with Penn University?
No, actually, getting to Penn was further down the line. It really came about by the delay and the difficulties in getting a diagnosis locally, mostly because of what a lot of people have to deal with, insurance problems.
How was the process then, how you got with Penn University and actually got a diagnosis?
Okay, so if we go back to the neurologist, I see the neurologist. He does his testing. He really agreed that there might be something going on with my memory. He ordered at that point a PET scan, what's called an amyloid PET scan. His concern with my father's history was that I had possible early onset Alzheimer's. So he ordered a PET scan, got it scheduled, and about 3 weeks later, he called me and he said, I'm trying to get it authorized through your insurance. And I think he worked on it for about a week or two, and finally insurance said, nope, we're not going to cover it. So I contacted the VA, which I'm also a veteran, and I go to the VA, and they're like, well, we don't do PET scans, but let's see if we can get one authorized. There wasn't enough information for the VA to authorize it. So now we're 2-3 months down the road, and we don't have a test to help define if I have Alzheimer's or not. My neurologist finally says, we've got a couple options here. One, we can push harder on the PET scan, but I don't think the insurance is going to authorize it. Or what's considered the gold standard is a lumbar puncture, looking at some of the results in a lumbar puncture. And obviously, a PET scan isn't invasive, and it would have been a nicer option. But at that point, I really needed to come up with an answer. So I said, yeah, let's go ahead and do the lumbar puncture. We went ahead and we had a lumbar puncture done. And the test results came back, and they weren't diagnostic, which was typical.
Meaning what exactly?
There's a couple of proteins they look at. One is the amyloid, which is the protein that actually binds in the brain and causes the brain damage. And I'm going to keep this simple. I'm not going to get into too many technical terms. The other protein they're looking at is something called tau protein, particularly p-tau, which is a protein that as the brain is damaged, that gets elevated. So for a diagnostic spinal tap, you have a low amyloid level because the amyloid's actually depositing in the brain. It's not in the fluid. You have a high p-tau level because the tau is being produced by the damage to the brain. And then they do something called the amyloid to p-tau ratio, which shows how much p-tau you have, and that gets lower as you get more p-tau and less amyloid. So now my results come back, and I see them like everyone else before my doctor even sees them. And my amyloid level was low, but my p-tau level wasn't high. It was on the high end of normal, but still normal. And like I used to tell a lot of patients, yeah, it's high normal, but it's normal. My ratio, however, was significantly lower than normal. So typical of what my patients would do, waiting for my neurologist to call me, I started Googling it and started doing a little bit of research. And, I was not a neurologist. I'm not an expert in these tests. As a matter of fact, I've never evaluated an Alzheimer's spinal fluid test. So I did the next best thing I could was the Google. Now I understand it probably a little more than the average person, but that did kind of come back equivocal, but consistent with Alzheimer's. So about a week later, I get in contact and I have a video meeting with my neurologist. And he said, well, we kind of have a problem here. We got equivocal results with your p-tau being normal. He said, I can't really diagnose it with that. So I'm going to try to get that PET scan. He said, that'll be more definitive now. Now back to the insurance. We've got to get the insurance to prior authorize the PET scan. We get the PET scan scheduled for about 6 weeks later. In the meantime, he said, I'm going to work on getting it authorized. I fortunately have a brother who lives in suburban Philadelphia who has a lot of medical friends from the University of Pennsylvania as neighbors. And he was aware that I was out of work for this and what was going on. And I said to him, Dan, I've got a problem here. My numbers are a little bit off. Do you know anyone in neurology at Penn? And he said, well, funny you should say that. The director of the Penn Alzheimer's unit is a good friend of mine. They actually are in a fantasy football league together. They're neighbors. He said, give me the numbers. Let me get to them and see what we can come up with. So I sent him the numbers, and he told the guy at Penn, Dr. Wolk, what was going on. And he said, yeah, I'd be happy to see him down here. I went ahead and made an appointment with him, which was actually scheduled for the day after the PET scan was scheduled to be done up here. So I was hoping I could get the PET scan results and share them with him the day I see him down there. So we go down to Danny's. I have the PET scan in the morning, literally get in the car. Portia and I drive down to Danny's, and we go to the University of Pennsylvania. Now, that was the plan. Guess what didn't happen? I didn't get the PET scan. The day before the PET scan, I get a call from the nurse at the neurology office that the insurance company denied the PET scan again.
Well, of course they did.
Of course they did. So now I have an unknown diagnosis. I have no further testing I can do to get a specific diagnosis. My neurologist rightfully can't, treat me with this because he can't say absolutely it's Alzheimer's or not. So I had talked to him, and he said, yeah, let's see what the specialist down at Penn says. So the next day we get down to Penn, we go to the meeting with Wolk. They take me back, and I do about 45, almost 60 minutes of testing with one of their neuropsychologists. I mean, all the flashcards, all the different memory tests. It's funny, the first thing I said when I walked in there is, please don't use apple penny chair, because that's like 3 things that we ask people to remember short term. I said, because it means there's no way it's going to test my short term memory, because that's like ingrained in my head. I said, I'm a retired physician, so, pick 3 different things. She's like, oh, that's good to know. So she actually adapted some of the tests, because there's a lot of that I had memorized from years, because one of the problems with Alzheimer's is more initially short-term memory than long-term memory. So to me, that wouldn't have tested my short-term memory. So I spent 45, 60 minutes just testing with her. As we're walking out, one of the fellows, which is a training resident in neuro, sees me and goes to the psychologist. Oh, is that Dr. McGuire? And she said, oh, yeah. He said, okay, yeah, bring him right in. We're in here. And I walk in, and there's Danny and my wife, Portia, sitting there. So I sit down, and I'm like, oh, wow. I have a feeling I know what they've been doing for the last 45 minutes. They've been telling on me.
Almost like an intervention.
Yeah. And I'm thinking, here we go. So he does it great. I probably spent 30, 45 minutes going over things with him. One of the things I failed to mention was something came up, and I got into a heated argument with Portia about a month before the Penn appointment. It wasn't, obviously not violent, but I mean, I was very emotional, yelling, and it was just something that I wouldn't yell about. It's just not my personality. And I had told my neurologist, and I had told him. So that's another thing that was kind of concerning. I know I had been a little emotional for the last 6 months, but that was the first time I actually, for lack of a better term, acted out. So I told him that. And he said, okay, let me take the information. We're going to go look at the testing. I'm going to go talk with Dr. Wolk, who's the specialist, and he'll be back in. So we sat there for about 10 minutes, and I was talking to Danny and Portia, and I said, yeah, I guess they wanted you to tell me. They said, yeah, they asked them a ton of questions, things that have been going on. And, we all kind of knew what was going on, and nothing surprising, I doubt. But, the fellow didn't tell me anything. So in walks Dr. Wolk, the specialist, the Alzheimer director at Penn. And he asked me a few questions. He said, I see you're on a couple medicines for anxiety and depression. And, in my head, the emergency bells are going off. It's like, okay, this is just mental health. I just kind of am stressed out. And literally 30 seconds later, he's like, but looking at your numbers, it's absolute. You have Alzheimer's. He said, this isn't equivocal. He said, you have early onset Alzheimer's. He said, the numbers you're seeing are because the amyloid is low because it's depositing in the brain, but my p-tau wasn't elevated because I don't have enough damage to the brain yet for the p-tau to have been that significantly elevated to show up. And he said to me, this is rare. He said, you're one of our earlier cases. We tend to see people later on or early Alzheimer's with early onset with a positive diagnosis already. But you're equivocal because being in a industry where you had to have a lot of insight into your ability to function and the safety of your patients, you realized you were struggling, and that caused you to basically put a halt to yourself and to protect your patients. And that led to us being here. And he said, these numbers tell me it's early. And then he went.
No, putting us on a. Yeah. Oh, I'm sorry, but putting us on a timeline. When was this conversation?
This conversation was last June, so it was June of 2025, early in the month.
And all right, so where does that put you right now as far as cognitively? Because anybody who's watched this podcast so far has heard you articulate, able to elaborate to get your point across. Any stumbling that you might have had would be no different than what I would have had or anybody our age would have had. So, I mean, for perspective, we're both 60 years old. We're about the same age.
Yep.
And in conversations with you right now, I don't see much of a difference. Now, you were a much smarter kid than I was, so maybe you're just catching back up to me now. I don't know, but where are you cognitively, if there is a timeline or a percentage, or how you feel at this point in time?
Well, by testing, I'm right at the borderline between what they call mild cognitive impairment and mild dementia. Some of my testing comes in the mild cognitive impairment level, and some of it comes into the mild dementia level. So I'm very early on. There's stages to Alzheimer's, but in general, you think of it as mild cognitive impairment, mild dementia, moderate dementia, and severe dementia. That's the process. And I'm in that borderline between mild cognitive impairment and mild dementia. So I'm high functioning. As much as I outwardly seem fine, I fight my brain more than I outwardly appear at this time. Things that came more naturally to me, I have to really form my thoughts carefully in my head, and I do it very quickly still. But at times, you're gonna ask me things, and at times it's gonna throw me off for a second, and I'm just gonna have to try to pull things out. I'm dealing with something that I'm really familiar with right at the moment, so it's easier for me to articulate it. But when you start asking me maybe more complex issues, it's going to be hard for me to think of, okay, what's the name of the medications? I may stumble over that a little bit. I still have some word finding issues, but right now when I'm talking about my story is pretty well ingrained in me right at the moment.
Yeah. So again, I said we're both 60 years old, and it becomes the ongoing joke and fear as you get older. You get into the mid to late 50s, and you forget something. Oh, it's my Alzheimer's, or oh, you make a mistake, and you're half joking about it, and then you're half like wondering, are these creeping in? These thoughts creeping in because there's so little to prepare you for it, or you don't see the signs. And so, like, I know for myself, 2 nights ago, right before I went to bed, I went downstairs for something, and then I just stood in my kitchen for probably 5 minutes because I couldn't remember why I went down, and I refused to go back upstairs until I got it. Now, again, that's typical stuff. Or like 2 weeks ago, I have no idea why. I was thinking about the movie Toy Story. No idea why that movie popped into my head. But I could not remember the name of the cowboy sheriff voiced by Tom Hanks.
Mm-hmm.
Now, we live in the age of Google. I could Google it right away. I could find out. I could ask somebody. But, I'm torturing myself. Like, I know this. I'm thinking Andy, Ham the pig. I could go through Sid, any character. I could name the voice actors, Don Rickles, but I can't get the name. And it probably took me about a good 15 minutes before I got the name Woody. And it came because I was remembering a scene where I think it's the dinosaur wearing Woody's hat and starts making fun of him. And I know this is a ridiculous story, but when you're 60 years old and something like this happens, something that's just a part of your life, and you can't get it, you start to get scared. Is this normal aging for me? Is that what I mean? Because everybody in this age group now, once you have a memory lapse,
Yeah.
now how much of it is also? Well, go ahead. I'll ask.
Yeah, no. I see what you're getting at. How do we define normal and how do we define abnormal memory loss with aging? It's not black and white. This is where you get into the art of medicine and things are gray. But for example, you went down to find something that night. Did you finally, after 5 minutes, figure out what you were going down for?
I did finally figure it out. It was that I wanted to set in a coffee maker so I could have coffee when I got up in the morning.
So losing things or misplacing things is not uncommon. We all do that. I generally put my keys on the island when I come in. And if my keys aren't on the island, I kind of get a little frustrated. Oh my gosh, where did I put my keys? Well, usually I probably put them in my coat pocket or something. The things that are kind of more worrisome is if I put my keys in the refrigerator.
Right.
Those would be an example of, as we age, we put our keys, down somewhere different. But it's abnormal if you're putting them in the refrigerator or if you put them on the back of the toilet seat type of thing. Having word naming things is not uncommon. That's not out of the realm of potentially normal. And it did come to you, but sometimes it just never pops in. I always used to say, I'll talk to you in an hour when it finally pops into my head. But that was normal at the time for me. Other things is change in emotions. Emotional changes are associated with dementia and Alzheimer's, i.e. me getting more anxious, more, I don't want to say depressed, but my mood was down. I was struggling to want to go in and see patients. That's associated with dementia and Alzheimer's. There's a few other things, and this is where I wish I'd wrote them down. I actually put them in my phone, and I could look them up real quick. But when you talk about losing things, that's it. It's not necessarily that you misplaced something or you forgot something. It's that you really can't pull it up, or where you misplaced it was a completely inappropriate spot.
I think maybe some of it is confirmation bias, that when you start forgetting things, I'm talking about just the average memory loss with aging, you start remembering all of these instances where you forgot something. But what I think we don't really pay attention to is we were forgetting things when we were 20 and 30 as well.
Right.
We just blew it off and laughed it off. Oh, stupid me! I forgot my keys, or where I put my keys.
Right, but once again,
as we get closer and closer, to the
right.
senior citizen golden years, we start attributing it to our age. I think.
Yeah, but that's when
when
you're putting it in the refrigerator because you drank too many beers.
Yeah.
I mean, that's the difference. Now we're not drinking the beer and it's in the refrigerator. You got a problem.
Yeah.
And then let's go back to the memory, forgetting things. Go back to my story with Sophie and her friend coming over, and me just completely blanking out that she had told me that her friend was coming over. And rather than initially immediately realizing why the friend was over there. I just told her, no, she's at work. You got to take her to her at work. I should have picked up on, no, you here, give me what you were going to give her. That's a little bit more than just forgetting something that you were told. And it's more short-term memory. That when you're name forgetting, that does occur with dementia and Alzheimer's, but that occurs with general aging. Your dementia in your short-term generally starts off with a short-term memory. It's, you just met this person, John, and you're someone who's really good at names. And then 30 seconds later, you're like, what's your name again? That's kind of the stuff that's more concerning. And you're saying, geez,
well, that would have been me at 20 as far as names
right.
go.
And I was...
It's not a good trait when you're a teacher
right.
that you struggle with names.
Right. But
it would take me months to learn my students' names.
I was never good with names. But then we go back to, here I was seeing 18 people in the course of a day. And at night, I could not for the life of me remember maybe one or two people I saw during the day. And it wouldn't come back to me until I actually looked at the list. Now, I could look at that list and pretty much remember most of what they told me because luckily I did my notes right at the time I saw my patients. But occasionally, prior to the last 6 to 12 months, I'd see someone and I'd maybe go see someone else and I'd do my note and that'd be fine. But I was finding that if I did that, I'd forget something and I'd be like, what did they tell me about that? And I couldn't pull it out. So I started just absolutely doing my notes immediately after seeing the patient. And that was another trigger in my mind that something wasn't quite right. So it's that short-term memory that's really affected early in Alzheimer's and other forms of dementia. Not necessarily completely the name remembering, but that will get worse with dementia, but not necessarily in and of itself. But if we're going to, share with people, the one thing that I'm going to say a lot during our podcast and during this whole journey is, when in doubt, see your doctor. If you're not sure, make an appointment with your doctor. There's cognitive testing they can do and discuss it with them. So far you haven't told me anything that, tells me, oh, Bill, join my club. You got to wear a pink and purple, a blue and purple t-shirt. No, but at the same time, I can't diagnose everyone. I can give you generalizations and I can give you ideas. But if you're really concerned, it's very easy. Get an appointment, talk with your doctor. If I didn't do what I did, I would have hurt someone, and that's not how I wanted to end my career. And I wouldn't have done it intentionally. I just would have forgot something that was important. And that wasn't going to be me.
So we're already over 40 minutes into this podcast, and we still have lots to talk about. As a matter of fact, my next question is a loaded one, John, that I really think is going to take you a long time to respond to. So maybe what we'll do is we'll break it up here. We'll call it part one, and we'll continue next time. And that way we won't have to cheat you out of your long response, and we won't bore the audience with an hour-and-a-half podcast. So if you'd like to find out when that will air or keep tabs on us and follow our journey, the best way to do that is to follow our Facebook page at Friends with Medical Benefits. There we keep tabs on our journey and make sure that everything we post ends up there as well. So until next time, thank you for following us and look forward to seeing you again later.